Have you ever wondered what happens when a really severe illness strikes, but even the best vets, the most expert investigations, they just can't pinpoint a cause?
Incredibly frustrating.
Yeah, it's a mystery, and it's not just something that happens in human medicine. Today, we're doing a deep dive into something called equine idiopathic colitis and typhlitis.
Right.
These are really severe inflammatory conditions, and they attack the horse's large intestine, the colon and the cecum.
And that word idiopathic, it's really key here, isn't it?
Mm-hmm.
It basically means that despite a really thorough investigation, running all the tests, a single definitive cause just remains elusive.
So it's not like they missed something.
No, not usually. It sets it apart from cases where we can say, okay, this was salmonella or this was a reaction to that specific drug.
Right.
Historically, this kind of severe, acute, unexplained colitis, it was often just lumped together as colitis X.
Ah,
But now, with better diagnostics, we've gotten much better at identifying specific causes for many of those cases. So when we say idiopathic today, it really means we've looked hard, and the why is still, well, unclear.
that's such an important distinction, and that's really our mission for you today.
Mm-hmm.
We want to unpack this incredibly challenging condition.
Yeah.
We'll guide you through what exactly goes wrong inside the horse, how vets essentially become detectives to diagnose it, often by ruling out a whole list of other things.
A long list sometimes.
Right, and the intensive care involved in treatment, and maybe most importantly, what the outlook actually is for these horses.
Mm-hmm.
So by the end, you'll have a really comprehensive understanding of what is truly a complex and frankly often devastating equine disease.
Absolutely.
So let's just reiterate that core definition again. Idiopathic means an unknown cause, an unknown etiology.
Exactly.
It's not about a misdiagnosis. It's a situation where, despite doing everything right, that clear trigger just can't be found.
It really is a huge diagnostic challenge. I mean, look, lots of colitis cases do have specific identifiable causes.
Like what? What are the common ones?
Well, you've got bacterial infections like Salmonella, Clostridium difficile, the one that produces those nasty toxins. A and B, maybe Clostridium perfringens.
Okay.
Then there are parasitic causes like Cythostominosis, the small, strong Gittle larvae.
Insisted ones.
Exactly. Or it could be drug reactions. NSAID toxicity is a big one we look for.
Like bute overuse.
Yeah, phenylbutazone. Exactly. That can cause, right, dorsal colitis. So idiopathic cases, they become what we call a diagnosis of exclusion.
Meaning you rule everything else out first.
Precisely. You run all the tests, check for all the usual suspects, and if nothing turns up, you're left with idiopathic.
Right.
We often suspect it's some kind of complex interaction between the horse itself, maybe environmental triggers, and definitely a major disruption of your gut microbiome.
Okay, let's unpack that cascade then. Because you said, regardless of the trigger, even if it's unknown the way the horse's body reacts, that follows a pretty similar dramatic path, right?
That's exactly right. It's a rapid, dangerous chain reaction. It generally starts with mucosal barrier disruption.
The gut lining.
Yeah, the lining of the intestine. Inflammation damages it severely. Now, this lining is crucial for absorbing nutrients and water, obviously.
Mm-hmm.
But just as critical is its job as a barrier, keeping gut bacteria and their toxins inside the gut and out of the bloodstream.
So the wall breaks down, it gets leaky.
You got it. Leaky gut, essentially. And that leads directly to the next problem. Massive fluid and electrolyte imbalance.
Okay.
Because that barrier's damaged, the horse can't absorb fluid properly. Instead, huge amounts of fluid plus vital electrolytes, sodium, chloride, potassium bicarbonate just pour into the gut.
So they're losing it internally.
Exactly.
Yeah.
Leading to severe dehydration, dangerously low electrolyte levels, hyponatremia, hypochloremia, hypokalemia, and metabolic acidosis because they're losing bicarbonate. It's a massive internal loss. Low protein in the blood, especially albumin. It leaks out through that damaged gut wall. Albumin is vital for keeping fluid inside blood vessels, so when it drops...
Fluid leaks out into tissues.
Right. You often see ventral edema, swelling under the belly and on the legs. It also means lower blood volume, compounding the shock.
Okay.
Then you can get coagulopathies, problems with blood clotting,
How does that happen?
that endotoxemia we talked about. It can activate the clotting cascade inappropriately. You can get this condition called DIC, disseminated intravascular coagulation.
That sounds bad.
It's extremely serious.
Yeah.
Tiny clots form everywhere, using up all the clotting factors, and then the horse can actually start bleeding uncontrollably. So clotting and bleeding problems at the same time.
Nightmare scenario. And the one complication every horse owner dreads. laminitis.
Yes, unfortunately, laminitis is a very common and often devastating complication. It's thought to be triggered directly by that systemic inflammation and endotoxemia.
Inflammation in the feet.
Severe inflammation within the hooves. It can cause the coffin bone to rotate or sink, which is incredibly painful and often leads to euthanasia.
Just awful.
And finally, if the shock and dehydration go on long enough, you start seeing other organ dysfunction. Acute kidney injury is common because the kidneys aren't getting enough blood flow. The liver can also be affected hepatic dysfunction.
So it really isn't just a gut problem, is it? It's a full-blown multi-system meltdown.
Precisely. It escalates incredibly fast, and it really underscores how vital that gut barrier is to the whole body's health. When it fails, everything can unravel.
Okay, so faced with this chaotic situation, how does a vet even start? You mentioned it's a diagnosis of exclusion. That means a lot of detective work first.
A lot of detective work. Before we can even consider calling it idiopathic, we have to meticulously rule out all the known identifiable causes.
Because they can look very similar clinically.
Exactly. The signs can overlap significantly.
Yeah.
So we systematically go through the possibilities. Infectious agents are high on the list.
Like,
Salmonella, there's a big one, common, very contagious. Clostridium difficile and its toxins, Clostridium perfringens. We also think about Neorickettsia rickettsia, which causes Potomac horse fever.
that's seasonal, right?
Yeah, often seasonal and regional. Also equine coronavirus. And in foals, sometimes Rhodococcus equia can cause diarrhea.
What about parasites? You mentioned those earlier.
Definitely. Larval cytostominosis, those small, strong IL larvae emerging en masse from the gut wall that can cause severe colitis, especially late winter, early spring.
Okay.
Then we have to consider drug-induced causes. NSAID toxicity, like we talked about, right? Dorsal colitis from too much phenylbutazone or other NSAIDs.
Right.
And antibiotic-associated diarrhea is another possibility. Sometimes treatment for one thing disrupts the gut flora and causes another problem.
Man, it's complex. Even necessary treatments can backfire.
They can. We also think about dietary issues,
Yeah.
sudden changes, grain overload, too many fermentable carbs, sand colic if the horse lives in a sandy area. Less common. But we check for toxicities, like cantharidin from blister beetles and alfalfa hay. And finally, we might consider other inflammatory conditions like IBD, inflammatory bowel disease, though that often presents more chronically.
So that's the list of suspects. How do you actually conduct the investigation? What are the steps?
It starts, always, with a thorough history and clinical exam.
Asking the owner lots of questions.
Tons of questions. Recent travel, any diet changes, deworming history, what medications has the horse had, any contact with sick horses, really detailed stuff.
And the physical exam, what are you looking for?
We look for the key signs. Diarrhea, which can be watery, profuse, maybe bloody colic pain, fever, depression, not eating. Assessing hydration is critical.
How do you do that?
Checking mucous membranes, are they tacky, pink, red? Is there a toxic line on the gums? Sunken eyes. Skin tenting. How quickly does the skin snap back when you pinch it? We listen carefully to gut sounds. Are they increased, decreased, absent? Feel for heat or pulses in the feet, checking for laminitis risk. Look for that ventral edema, the swelling. And a rectal exam is usually essential.
What can you feel there?
You might feel thickened loops of large intestine, maybe a distended, fluid-filled cecum. It's often painful for the horse. It gives us valuable information about what's going on inside.
And then you move to lab tests. Blood work.
Absolutely crucial. Laboratory diagnostics give us the systemic picture. A complete blood count, the CBC, is key.
What does that show?
Often we see leukopenia, a low white blood cell count, especially neutrophils, sometimes with that left shift, meaning lots of immature neutrophils are being pumped out.
Which means?
It's highly suggestive of severe inflammation, endotoxemia, maybe sepsis. The body's using up its mature defenders. We also look for hemoconcentration, which tells us about dehydration, and maybe thrombocytopenia, low platelets, which hints at DIC.
Okay. What about blood chemistry?
The serum biochemistry panel is also vital. We almost always see low protein, hypoproteinemia, or hypoalbuminemia, and those electrolyte imbalances we talked about. Low sodium, low chloride, low potassium.
Right.
We also check kidney values, BUN, and creatinine, which are often elevated due to dehydration, that's pre-renal azotemia. And we assess acid-base status, usually metabolic acidosis, with low bicarbonate and maybe high lactate.
What about fecal tests? Can you find anything useful in the manure itself?
Yes, fecal diagnostics are essential for ruling out those specific infectious causes. We'll run cultures for salmonella, PCR panels that can detect Clostridium difficile toxins, equine coronavirus, rickettsia, and others.
Okay.
We'll do a fecal egg count to check for parasites like cyathostomonas and a fecal sand test if that's suspected.
Are there other tests you might use?
Sometimes,
Hmm.
an abdominocentesis or belly tap where we take a fluid sample from the abdomen can check for peritonitis. A rectal biopsy might be done if we suspect IBD. An abdominal ultrasound is really useful.
What can you see with ultrasound?
We can look at the thickness of the bowel wall, check for excess fluid in the gut or abdomen, and assess motility, how well the gut is moving.
Wow. So it's a massive workup.
It is, and it's only after all of this fails to pinpoint a specific cause that we arrive at that diagnosis of idiopathic colitis. It's truly a diagnosis made by excluding everything else.
So, okay, you've done all the detective work, ruled out the knowns, and you're left with idiopathic. There's no single bug to kill or toxin to counteract directly. So treatment becomes about, intensive supportive care.
Exactly. It pivots entirely to intensive supportive care. The goal is to stabilize the patient, correct the life-threatening imbalances, and give the horse's body, especially the gut, a chance to heal. It's a lifeline.
What's the absolute #1 priority?
Fluid and electrolyte replacement. Without a doubt, it's paramount. These horses are incredibly dehydrated and depleted.
So IV fluids, lots of them.
Massive amounts. We use intravenous crystalloid fluids, things like lactated Ringer's solution or normal saline, often at very high rates, especially initially. We constantly monitor hydration and adjust the rate.
And replacing those lost electrolytes.
Absolutely vital. We supplement IV fluids with potassium, sometimes calcium and magnesium, based on repeated blood tests. And if the blood protein, the albumin, is dangerously low.
It's a hyperproteinemia.
Right. If that's severe, we often need to give colloids. That can be plasma transfusions, which provide albumin and clotting factors, or synthetic colloids like hetastarch to help pull fluid back into the blood vessels and maintain blood pressure.
Okay, so fluids and electrolytes first. What about fighting that runaway inflammation and the endotoxin?
That's the next critical pillar, anti-endotoxemic therapy. We need to try and neutralize those circulating endotoxins.
How?
One drug we use is polymyxin B. It binds to endotoxin.
Yeah.
We also use NSAIDs like flunixin and glumibanamine, but carefully.
Carefully. Why?
Because high doses can worsen potential kidney issues or gut ulceration. So we use lower anti-endotoxin doses. Other drugs like pentoxifylline might be used to improve blood flow, and sometimes an intravenous lidocaine drip, a constant rate infusion, can help reduce inflammation and pain.
Interesting. And what about helping the gut itself heal?
Good question. That's gastrointestinal support. We might use probiotics like Saccharomyces boulardii, trying to help restore a healthier gut microbiome, although the evidence in acute cases is still developing.
Okay.
We use mucosal protectants, things like psyllium, maybe bismuth subsalicylate, sucralfate, to try and coat and soothe that inflamed lining.
Do you feed them?
Initially, often no. We might hold them off at MPO, nothing by mouth, for 24, maybe 48 hours to let the gut rest. Then we very gradually reintroduce food.
What kind of food?
Easily digestible, high-fiber stuff. Soaked hay pellets are often a good start. Definitely avoid grains and high-starch feeds. And something gaining traction is fecal transformation.
Transferring manure from a healthy horse.
Essentially, yes. Transferring healthy gut microbes from a donor. It's particularly considered in antibiotic-associated cases, but sometimes used in idiopathic ones too, to try and reset the gut ecosystem.
What about antibiotics? Are they used if the cause is idiopathic?
That's antimicrobial therapy, and it's often controversial.
Why?
Because antibiotics themselves can further disrupt the microbiome, which is already in chaos. However, but if we strongly suspect an underlying bacterial component we haven't identified, or if the horse is severely neutropenic, meaning their white blood cell count is dangerously low, making them prone to sepsis, we might use broad-spectrum antibiotics like metronidazole, maybe combined with something like ceftiofur, as a preventative measure against secondary infection.
Makes sense. And then there are the big complications, laminitis, clotting. How do you try to prevent those?
That's huge. Prevention and management of complications is key. For laminitis prevention, the best evidence is for cryotherapy.
Icing the feet.
Continuous icing, ideally. All 4 feet. Often using continuous cold water immersion systems or ice boots packed constantly. It's one of the most effective things we can do. Deep bedding also helps cushion the feet.
Okay.
For thrombosis or clotting prevention, low-dose heparin might be considered. And because these horses are stressed and often not eating well, we usually put them on medication to prevent gastric ulcers like omeprazole or ranitidine.
And all through this, you're watching them like a hawk.
Constantly. Intensive monitoring is non-negotiable, checking vital signs frequently, heart rate, respiratory rate, temperature. monitoring urine output to assess kidney function and hydration, checking mucous membrane color, capillary refill time, frequent blood work to track electrolytes, protein levels, kidney function, blood counts. It's 247 care, often for many days, sometimes weeks.
It sounds incredibly intense, a real battle. So after all that, for the owners listening, what is the road ahead? What's the actual prognosis for a horse that gets diagnosed with idiopathic colitis or typhlitis?
Yeah, that's the tough question. Honestly, the prognosis is generally guarded, and it's highly variable depending on the severity,
Guarded meaning.
meaning recovery is uncertain and there's a significant risk of death. For acute, severe cases, the ones with profound dehydration, really low protein levels, severe leukopenia, major signs of endotoxemia, the prognosis is guarded to poor.
What kind of mortality rates are we talking about?
It varies, but reported mortality rates can be high,
Yeah.
often in the range of, say, 10 to 40%, but in really severe outbreaks or cases, it can unfortunately be 20 to 50% or even higher. Some horses can deteriorate and succumb incredibly quickly, sometimes within 8 to 24 hours of showing severe signs.
That's terrifyingly fast.
Yeah.
Are there specific signs that make you particularly worried? Things that point towards a poorer outcome?
Yes, there are definitely factors associated with a poorer prognosis. Marked and persistent hypoproteinemia, if we can't get those protein levels up, is a bad sign. Severe dehydration and shock that's difficult to reverse. Persistent low white cell counts, especially that severe neutropenia with a left shift. Obviously, developing laminitis is a major negative factor, often leading to euthanasia. Developing DIC, those clotting problems, is also very grave. A lack of response to that aggressive fluid therapy is concerning. And interestingly, sometimes horses that develop ileus, where the gut just stops moving completely instead of having diarrhea, they can actually have a worse prognosis.
Wow. What about the ones that do pull through the initial crisis? Is it smooth sailing after that?
Rarely. Long-term recovery is often a slow process. Horses that survive that acute phase usually need prolonged hospitalization, continued supportive care.
Weeks.
Often weeks, yes. And even after going home, they might have persistent soft feces or bouts of diarrhea for weeks or even months. Full recovery takes time.
Are there lingering issues? Long-term complications?
Unfortunately, yes. Long-term complications can include chronic laminitis, which can be life-limiting. Some horses experience recurrent colic episodes. Others might have ongoing issues with poor performance or difficulty maintaining weight, likely due to some degree of chronic intestinal inflammation or a permanently altered gut microbiome dysbiosis.
This really just hammers home how critical early recognition and aggressive, intensive veterinary care are, doesn't it? It sounds like time is absolutely of the essence.
Absolutely. Getting these horses diagnosed and starting that intensive supportive care fast is probably the single biggest factor in improving their chances of survival and minimizing those devastating complications like laminitis.
For owners, knowing those early signs, the sudden diarrhea, the depression, the colic, and calling the vet immediately seems crucial.
It can literally be the difference between life and death. And it's important to remember, even though we call it idiopathic because we don't know the initial spark, successful management focuses entirely on supporting the horse through that systemic firestorm, the inflammatory cascade, and helping the gut heal. We treat the reaction even if the trigger remains a mystery.
This whole deep dive into equine idiopathic colitis and typhlitis, it really shows, well, not just a complex veterinary puzzle, but also the incredible resilience horses can have and the sheer dedication it takes from vets and owners to pull them through.
It truly does.
It's a powerful reminder, I think, that sometimes the best approach isn't about finding a single cure for something unknown, but about masterfully managing the body's own overwhelming response.
And that makes you think, doesn't it? It raises a broader question. When we face any medical mystery, maybe in animals, maybe in people, how much do we need to pinpoint that exact cause versus really focusing on understanding and mitigating those downstream effects, that cascade happening inside the body?
That is definitely something for you to ponder long after our deep dive ends. Thank you so much for joining us today.